Muhammad B. Rahman. He is Associate Professor, Department of Business Administration and Member Secretary of Tobacco Control and Research Cell of Dhaka International University. He has also 20 publications and he has attended several international seminars, workshops, and conferences in connection of the tobacco control. So now it is over to Mr. Rahman.
Thank you, sir. Honorable session chair, respected speaker, and dear viewers, good afternoon. I'm very honored to be a part of the prestigious conference. Now I'm going to present my presentation, that is introduce the standard packaging for smokeless tobacco and BD for effective implementation of pictorial warnings in Bangladesh. Next, please. So Bangladesh government enacted tobacco control law in 2005 and amended in 2013, along with passed the rules in 2015. After passing the rules, graphic health warnings has been implemented from 19 March 2016. And we, Tobacco Control and Research Cell of Dhaka International University, is working since 2016 for compliance the monitoring of pictorial warnings. And it was much challenged, but we have implemented the issues very gently. Next, please. So I'm going to share the tobacco using format in Bangladesh. Mostly 5 types of tobacco product category used. That is the cigarette, the bidi, the jorda, gul, and shadabata. Shadabata is totally out of monitoring because it's a raw tobacco leaf. In Bangladesh, 10, 12, and 20 stick paper pack used for cigarette, 20 to 25 filter and non-filter round cylinder shape paper pack used for BD. It's the soft paper pack, and different shapes, structure, a smaller round shape pack, paper round shape, tin, plastic casket with attached additional paper polypacket are using for packaging of jorda and gul. That is, you have seen in picture BD, jorda, gul, and shadabata. Next, please. Here you some picture of different category of jorda, gul, shadabata. Next, please. So I'm going to share you how we introduce the standard packaging and what we mean for the standard packaging. It means a specific size, structures, color, and packaging ingredient shall be used by smokeless tobacco and beer industry for pack their product. They cannot use not less than the proposed pack size, which we have already proposed to the National Tobacco Control Cell, Ministry of Health and Family Welfare. Our basic objective is to monitor the graphic health warnings and for working for effective implementation the graphic health warnings in Bangladesh. Within that, we have developed a graphic health warning monitoring software by using the ODK tools. That means the Open Data Kit tools. This is the first time in Bangladesh to develop this sort of software. Basically, this is a compliance monitoring software with using the GPRS location systems to collect the 6 pictures. So now I want to share with some twist point, that is we have collected 10,641 packets from all over the country. That means we covered all 64 districts out of 64 and 64 sub-districts. We find out or we identify 265 big market. I mean the wholesale market area, where we identified 583 wholesale shops. Next, please. So before I have said that we are working for monitoring the graphical warning implementation. That for this reason we have developed already a software. Then after collecting the information, or after even when we are developed the software, we have developed a working protocol on the basis of Section 10, or you can say that the checklist for compliance on the basis of Section 10 of tobacco control law. We covered all subsection of Section 10, and after collecting the data, I mean monitoring data, we prepared a report and we organized a press conference to disseminate the outcomes, basically highlighted with the violations of graphical turnings implementation. Then we submit it to the related authority. That means the district administration, from which districts we collect the information to show the violation of graphical turnings, and requested them to take initiative to against this violation. And with this, the graphical turnings implementation has been increased, but it some challenges. Then we identified some challenges. Next, please. So the major challenges I have shown just here. In SLT section, the total SLT section is unregulated, unregistered, even the BD also. But for graphical turnings, we identified some challenges, that is the different size and shapes. I have already shown you in earlier slide. That is the very smaller size, round cylinder shapes. They print additional paper and attach with the pack. When they open the pack, they throw out the additional paper. For the focus, the packet, I mean the owner of the Jorda, BD or Gul company, the focus is only their own image. Then they use the weak packaging ingredient, they use polypack, they use plastic casket, soft paper pack, then they use cylinder shaped BD pack made by soft paper, cover pictorial image by bandroll, even the pack also. Next, please. So beside this, the tobacco industry using attractive color, mosque theme design, halal, Arabic letter, Indian packet design with Hindi letter, religious brand name, logo and color, Muslim and Hindus, religious logo, religious color theme, I mean the uh, temple theme, the mosque theme, and draw customer attention. SLT product, especially Jorda, using different brand element. That means Bangali, the Shade Gandhe Otulunio. That means taste is awesome, the best quality, Shadi Alada, that means the taste is different, and adding different flavor for creating positive mindset. That means the not harmful. They try to show that is not harmful among the users. To protect these barriers, these challenges, we thought that how we can implement effectively the graphical turnings. For these reasons, we search a suitable and affordable packet which is available in current market rather than introduce a new packaging model. Because if we introduce a total new model, the tobacco industry, they totally denied that we cannot make this packet. For this reason, we collect a suitable and affordable packet which is already exist in the market. For this, we collect 10,641 packets. We analyze this package to find out a suitable packet. And after find out a suitable packet, we select a packet, a specific packet for Jorda, and a specific packet for Gul, and a packet for Biri, which is made by cardboard. It's for a already exist in the market, but it for a filter BD packet. Next slide, please. So then we organize a sensitization meeting in supporting with the National Tobacco Control Cell, that means Ministry of Health and Family Welfare. The program was conducted on 25th January 2017, where Ms. Roxana Kader, former Additional Secretary of Wealth and Public Health, Ministry of Health and Family Welfare, make direction in the meeting to introduce standard packaging. We find out the specific model and submit it to the National Tobacco Control Cell, Ministry of Health and Family Welfare, National Board of Revenue, that means the NBR, Director of National Consumer Rights and Protection, and Bangladesh Standard and Testing Institution, who covered the Packaging Act. Later on, NTC, I mean the National Tobacco Control Cell, has taken initiative to organize a meeting for discussing or share the standard packaging model. And on 9th October 2019, the Ministry of Health, I mean the National Tobacco Control Cell, organized a meeting in presence of different ministry delegates, National Board of Revenue, Director of National Consumer Rights and Protection, other tobacco control community, all the tobacco control community in Bangladesh who work currently working, where we present the standard packaging model. We have developed a physical model, and we present in favor of this standard packaging. Then the NTCC and other ministry delegate, including all the tobacco control community, has agreed and decided to enact the standard packaging model in the meeting. And this is a great achievement for Bangladesh, we think. And later on, just 2 days before, we meet with the coordinator of National Tobacco Control Cell to enact the standard packaging. He agreed with us, and they uh, did make direction to their officials how we can implement this, and we will going to organize a meeting, and it will be held in recently. So next, please. Next, please. So that's all from my part. Thanks for your kind attention, and thank you very much.
Thank you, Professor Rahman. And have congratulations from my side that you have very nicely presented the challenges that is overcoming in implementation of the tobacco control law in the country as far as the package warning is concerned.
Yes.
Yes, the government and the tobacco industry, you are working together. So I think that you have a very good role model, and that is going to definitely work. And in few months' time, if you just sustain to your pushing up from the, and in Bangladesh there is a networking of the NGOs, so that is also good. So please put it forward, and one day we can see that all the products in Bangladesh can have the graphic health warning. Thank you very much.